I'd like to introduce Dr. Andy Lawson. He is actually a resident of Woodbridge, and he is a radiologist at Diagnostic Radiology Associates of Waterbury. I am going to do a little bit of an introduction quickly and then let the expert do the talking. I want to thank this committee for always putting the health of women first. We have come to this committee on many occasions to discuss issues and the new technology and new information we have as to keeping women and men and citizens of this state safe. So I want to thank you for doing that. I'd also like to take a moment to remember Dr. Nancy Capello. I'm sure most of you remember her. She passed away November 15th. She was obviously a doctor and a breast cancer survivor, but a person who was probably the best known advocate for breast cancer and prevention, and in particular with her Are You Dense campaign, which is very relevant to what we're going to talk about today. So I wanted to just put that on the record. As I mentioned, we're proud of the work we've done. I'm proud of the work that I've been able to do with the 3D mammography with tomosynthesis and making sure that women are able to access it and get it paid for. And the bottom line is we are able to help save lives and save money for the state because of it. The bill we're going to talk about today is, and I'll put it right up there, it is costly, but I think it's something that's very important to have a conversation about when we talk about prevention and saving the lives we've been able to save throughout time, and hopefully we can save many more. So right now I'm going to pass it over to Dr. Lawson to talk about the bill.
Is this on?
Now it is.
Okay. Thank you, Representative Klarides and the members of the committee. Besides being a radiologist in Waterbury, I want you to know that I do read mammograms, I do read breast ultrasounds, and in addition, I've been past president of the Radiologist Society of Connecticut, so I'm familiar with how legislation works on these types of things. And I wanted to specifically talk about ultrasound in women with dense breasts. Traditionally, a standard approach for women's imaging is to perform a mammogram. As technology has changed over time and advanced, we've included, and the committee and Representative Klarides has been very helpful in this, including tomosynthesis. And we're in a situation now where we've identified a group of women who are at higher risk, and those are women with dense breasts. And just very basically, there's 4 densities that we describe on mammogram, and the women in the 2 highest density groups are at higher risk of breast cancer, and also it's harder to detect on mammography cancers in women with dense breasts. Mammography is covered as a screening exam on most, or by legislation on insurance plans, and ultrasound is also covered, but it's not covered from the standpoint of being exempt from deductibles or plans with high deductible plans. So what will frequently happen is a woman with dense breasts will come in for a mammogram, will see no abnormality on it, but say this woman has dense breasts, it's harder to see a cancer, they're at higher risk, and we recommend a screening ultrasound. Patients will frequently call their insurance company, ask if it's covered, and the insurance company will say, yes, it's covered. So the patient will come in for the breast screening ultrasound. And after we perform that examination, they'll receive a bill and an EOB from the insurance company and find out that although it's covered, it hasn't met their deductible. So the whole cost of the exam is an out-of-pocket expense to the patient. So what we're one of the things that we would like to do, and this isn't directly covered in the bill, but I think it should be considered, is putting mammography or ultrasound in the same position as mammography, of not having these screening examinations that women need be subject to deductibles or copays. And as Representative Klarides said, there is cost associated with this. We do realize that this is a high cost expense, but we're comparing that cost to the cost of detecting the cancers later on at a more advanced stage. And that's an even higher cost, not just financial, but emotional and healthcare as well. So we think that although we're aware of the higher costs, we think that it's a long-run cost savings to get these ultrasounds done.